Okay, I'm back, and in this video lecture, we're going to be talking more about coding disorders and diseases of the genitourinary organs. Again, kidney stones, something that can cause hydronephrosis or fluid backing up in the kidney. Can be of the kidney or the ureter, the lower urinary tract, or what have you. The renal calculi most of us are familiar with. These go through the N20 through N22 code categories. You can also have malignant neoplasms or malignant cancers. Again, this would be like coding any other type of cancer using the neoplasm table. However, you do want to look to see what specific location of the bladder the cancer is in, because that will give more specificity to the other characters. It could be the dome of the bladder, what have you. And again, a lot of people are familiar with inflammation, the prostatitis, the BPH, the hydroceles. If you're not familiar with these types of terms that you see here, oligospermia, the erectile dysfunction that you see ads for every time you turn around, there are medical dictionaries to get into the finer details of exactly what these things are. Sexually transmitted diseases. Again, a lot of these are infectious diseases, so they'll come out of the first chapter that we took a look at. These are the chlamydias and so on, the herpes, gonorrhea, and again, B20, if somebody has AIDS, they are either B20, or if they're HIV positive, but they don't have any evidence of the disease, or they're asymptomatic, they're Z21. They can't be both. There is a special carve out we'll talk about with OB related HIV cases in a little bit. And again, more of these sexually transmitted diseases, the HPV, C1151, the R87 abnormal findings. Again, those are considered symptoms when they're described as findings. PID, again, a lot of these, PID is kind of the global term. It could be related to chlamydia, other things. So you can see that here, A56, A54, A50, what have you. Trichomoniasis, the A59s. Again, note how they all start with A because they're microorganisms, infectious disease. And then we have encounters for GYN care. Anyway, GYN, OB, we use these things interchangeably. Some physicians do both. Some, for instance, some in Kaiser just specialize in one. We can have GYNs who specialize in the care of female genital organs, or the obstetricians, which are the specially trained physicians who deal with delivering babies in the postpartum period. We have routine encounters for GYN checks, the Z01.411, Z01.4119. The difference is one has abnormal findings, one is without. If you report something with abnormal findings, it's kind of obvious that you have to report what these things are. Common GYN disorders that we see: endometriosis, N80, fibroids, D25, and then going back to what we learned in the guidelines about symptoms versus diseases, pelvic pain that doesn't have a diagnosis is R10.2. Procreative management could be a lot of different things, could involve genetic counseling as per the second bullet point, could be counseling advice on procreation, could be encounter for females for genetic testing, or encounter for other genetic testing or for procreative management as described in Z31.438. Obstetrics care, again, we have pregnancy test if you're having an encounter, main term encounter. For testing, Z32.01, that's an encounter for a pregnancy test that's positive. And when we talk about getting into the OB codes, we're going to look at first trimester, which is from the first day of the last menstrual period to 14 weeks, to less than 14 weeks, 14 weeks to less than 28, it's the second trimester, and 28 until delivery is the third. Going to stop here because one of the key points when we talk about coding conditions during gestation for women is that we want to make sure that we capture the trimester. The trimester is not only used to clinically manage the patient, it's also an important part of driving the correct code selection. That's all I have for you. Come back in the next set of video lectures and we'll be talking about more of these codes that we see during obstetric care through the first 3 trimesters.